So I ended up doing internal medicine, and I fell in love with heart failure in the ICU, really sick patients with heart disease, and helping them get better and get home to be with their families. If you've been hospitalized with heart failure, median survival is about 2.5 years. And patients who have heart failure typically have 3 or more comorbidities. Our goal is to really help them live the best life they can for as long as they can. We wanted to be able to take all of these remote monitoring devices that measure patients' blood pressures, pulmonary artery pressures, their ICDs, that measure heart failure markers, and take a central team and be able to manage patients from across the New York metropolitan area while they're in their homes. All of that data automatically comes into our medical record. We can see it every day. We get alerted if it's abnormal. Data that's actionable is really critical. And in patients who have heart failure, that is the Achilles heel, right? If they have pre-symptomatic changes, things that are happening in their body before they feel breathless, before they feel fatigue, we can see that happening and act proactively before they feel unwell to help prevent them from coming to the hospital. So we've been tracking the outcomes, and we have shown that patients are going to the hospital much less. There's been an 81% reduction in heart failure hospitalizations and a 64% reduction in all-cause hospitalizations. So one of our big goals is to be a partner with your doctor, whoever the patient's doctor is. So really reaching out into our communities, trying to help the primary care doctor take care of these really complicated heart failure patients. And patients love the program. They feel more involved and educated about their medical decisions that are being made for them, what medications that are being chosen for them. They would recommend the program to their friends and family. The use of artificial intelligence is something in medicine that's going to probably change how we care for our patients. We're taking 20 years worth of medical data that lives within the medical system, in the medical record, and curating it, making sure that we can look at that data and understand how have patients progressed in their heart failure over time. I think what will happen in the future is integrating that data, using it to make smart decisions, having an AI platform to be able to understand kind of what are the new pre-physiologic changes that are happening, or what is the right therapy for each individual patient based on their phenotype. And how do we get those patients teed into the right therapies, the right providers at the right time? I think it's really leaning on the team, right? It's taking this broad team that we have, everybody from the nurses to the physical therapists, to the nutritionists, to the surgeons, to the doctors, applying the technologies that we have to the right patients and helping patients everywhere be able to get more care. I would go nowhere else, and I would work nowhere else because of the team.